This presentation addresses a paradox. If vegetarian diets are supposedly healthy, why do some vegetarians develop heart disease and diabetes? The answer is nuanced and requires evidence-based understanding of diet, quality, study design limitations, and individual cardiovascular risk factors. Today I will cover what the research actually shows, not dogma but data. I'm Dr. Fernandez on the Cardiology 305, Miami cardiologist. Important disclosure: this is educational content based on 21 systemic reviews published between 2018 and 2024. We're synthesizing current evidence, not making individual recommendations. Always emphasize individual decisions require consultation with the patient healthcare team. Today's agenda: we'll cover six main areas. First, define what vegetarian means. Second, address cardiovascular outcomes directly. Third, tackle the diabetes question. Fourth, examine confounding factors. Fifth, differentiate healthy from unhealthy plant-based diet. Finally, provide clinical recommendations. Vegetarian dietary patterns define. Vegans exclude all animal products. Most restrictive. Lacto-ovo vegetarians include dairy and eggs. Pesco vegetarians include fish but no other meats. Semi-vegetarians eat meat occasionally. Key point: these diets have very different cardiovascular and metabolic outcomes. Vegetarian diets and cardiovascular disease risk. Yes, vegetarian diets reduce cardiovascular disease risk. Meta-analysis of 21 systemic reviews shows 15% lower cardiovascular disease incidence, 25% lower ischemic heart disease mortality, 8% lower overall cardiovascular mortality. However, these are primarily observational studies, no randomized controlled trials. We cannot definitely prove causation. Lipid profile improvement. One mechanism for cardiovascular benefit. Total cholesterol approximates 0.34 millimeters per liter, lower in vegetarians. LDL cholesterol 0.3 to 0.4 millimoles lower. Lower body weight and BMI. Caveat: this only applies to those eating healthy plant-based food. Processed vegetarian diets don't show this improvement. Additional cardiovascular risk factors. Fasting blood glucose about 0.4 millimoles lower in vegans. A1C and glycemic control is better. C-reactive protein reduced. Blood pressure effect is mixed. Important. Homocysteine often elevated in vegans due to B12 deficiency. Elevated homocysteine is a cardiovascular risk factor. The diabetes paradox. Adventist Health Study 2 data show vegetarians have lower diabetes rate, not higher. Non-vegetarian 7.6 prevalence versus vegan 2.9%. Progressive reduction moving towards a stricter plant-based diet. Critical insight. Vegetarians also adopt other healthy behaviors, more exercise, weight loss, no smoking, less alcohol that independently prevent diabetes. Why some vegetarians develop diabetes? Diet quality is paramount. Healthy plant-based diets show 50% diabetes risk reduction. Unhealthy plant-based show no benefit. Exercise essential. Diet alone insufficiency. Genetic predisposition matters. Weight management is a primary driver of type 2 diabetes. Other lifestyle factors, sleep, stress, smoking contribute independently. Healthy versus unhealthy plant-based diets. Healthy, whole grain, legumes, vegetables, fruits, nuts, seeds, 15% lower diabetes risk. Unhealthy, refined grains, sugary drinks, processed meat, alternatives. No diabetes benefit. Key: the vegan label means nothing if diet quality is poor. 2025 Lancet study on processed plant-based diet had a 44% lower cardiovascular disease incidence. Ultra-processed plant-based show no benefits. Confounding factors. Most evidence from observational studies, not randomized controlled trials, cannot prove causation. Self-selection bias. Vegetarians exercise more, don't smoke, have higher factors independent improvement health. Publication bias favors positive studies. Measurement error. Dietary intake self-reported. Unmeasured confounder. Stress, sleep, Healthcare access. More accurate statement. People following high quality plant based diet and healthy lifestyle have lower cardiovascular disease. Nutritional concerns in vegetarian diet. Vitamin B12. 52% of vegans deficiency level 132 millimoles vegans versus 282 omnivores. B12 deficiency causes elevated homocysteine and worsens neuropathy. Any vegan must supplement B12, mandatory. Iron less viability from plants, anemia risk. Calcium often low without fortified food. Zinc, selenium, omega 3 less available or absent. EPA, DHA. Cardiovascular disease in vegetarian. Even with cardiovascular benefits, some vegetarians develop heart disease. Cause non adherence to diet quality, lack of exercise, hypertension, smoking, excessive alcohol, diabetes, stress, sleep apnea, genetic predisposition, B12 deficiency, which lead to elevated homocysteine is independent cardiovascular risk factor. Plant-based diet doesn't eliminate need for comprehensive risk factor management. Vegetarians need blood pressure control, lipid management, diabetes screening, stress reduction, exercise, sleep optimization, and smoking cessation. Evidence summary. Cardiovascular benefits is moderate. 50% lower cardiovascular incidence, 8% lower cardiovascular mortality, 25% lower ischemic heart mortality. Benefit depends on diet quality. Diabetes protection strong. Vegans 2.9% diabetes versus 7.6 meat eaters. Health quality plant-based 15% lower risk. Unhealthy plant-based no benefit. Caution: B12 deficiency in 52% of vegans. Iron, calcium, zinc, omega 3 requires attention. Supplementation is mandatory. Clinical recommendations. Cardiovascular prevention. Plan forward diet reasonably. Doesn't require strict vegetarian. Quality over label. Focus on whole plant foods. Individualization tailored to each patient. Vegetarian patients screen B12, iron, vitamin D, omega 3, comprehensive approach. Exercise, blood pressure management, stress reduction, sleep deprivation, optimization, smoking cessation, not all or nothing. Gradual reduction is more suitable. Diabetes prevention. Emphasize weight management, physical activity, whole plant foods. Key takeaway. Yes, vegetarian diets associated with lower cardiovascular risk, but quality matters. No, vegetarians do not have higher diabetes rate. Confounding factors explain some benefits. Study designs limitation. Most evidence observational. Unhealthy plant-based offers no protection. Comprehensive risk factor management essential in all populations.